You're watching a very special edition of the Wellness Hour. I'm Randy Alvarez. Today's topic is identifying and treating subacute illness. That is, catching illness in its developmental stage. If you want to feel your best, or if you have failed conventional drug therapies, my advice, stick around for the latest edition of the Wellness Hour. I have two doctors on today's show. My first guest is Harry Eidner, Jr., Ph.D. Dr. Eidner is a graduate of Columbia State University with a Ph.D. in health sciences. He is an active consultant to more than 3,000 physicians in the United States, Europe, and Canada. Dr. Eidner is nationally recognized for his expertise in blood chemistry analysis. Dr. Eidner, welcome to the show.
Thank you. It's a pleasure to be here with you, Randy.
Now, we're talking about blood testing, blood screening. How did you get involved in that?
Many years ago, I was part of a project that was called the blood biopsy. It was a test that was done mostly by physicians who were associated with Michigan State University. We followed 10,000 people for 10 years, and we found that the laboratory ranges, or the pathological ranges that were used by most laboratories, were simply too broad to identify subacute or early changes in blood chemistry.
When you say broad, what do you mean?
What I mean was that the symptoms of degeneration or change indicating subacute illness were existing or present a long time before the chemistry exceeded the range of that particular chemistry, such as SGOT, which is a common enzyme run for liver function.
Okay, let's take the liver function test.
Okay, at that time when we first started, most of the laboratories indicated that SGOT was normal between 0 and 60, 0 to 60.
Okay, so I get this right. You take a blood test for the liver, and on the sheet itself, it says 0 to 60, and then a person's blood work will land somewhere in between there. Is that correct?
If it's normal at that time. Now,
Sure.
The laboratories have modified their ranges significantly, some of them, since then. However, at that time, it was 0 to 60. Now, most of the laboratories, it may be up to 50. But we found that changes indicating biliary, gallbladder, pancreas, liver, were present a long time before the blood chemistry changed. What we found was that the systemic changes or the symptoms were present when the blood chemistry, SGOT, was between 30 and 40. 40 to 50 and 60, they were definitely there. Some of the changes you see with liver dysfunction are or biliary or gallbladder is an inability to tolerate fatty food, gas and bloating after meals, a pain between the shoulder blades, a headache over the eyes after ingesting fatty food. These symptoms were present, and the patients were being told, oh, there's nothing wrong with your liver. Your liver is just fine. Somebody at that time is where we intervened and said, maybe you should quit eating fried foods for a while, maybe you should drink more water, maybe you should exercise, maybe you should get the refined carbohydrates out of your diet, and maybe you should eat some foods or supplement with nutrients that'll promote biliary or liver gallbladder function.
Okay, so with these people, you're saying they're going undiagnosed with a problem. So for example, if in our system, in the busy medical system, somebody goes in, they can have all the symptoms you're talking about, but if they're below the old lower ranges, they're not going to get the medical attention that they deserve, in your opinion?
Well, they're not going to get the attention they deserve. Obviously, somebody's going to simply tell them it's all in your head, or
and people are being told that.
Come back when your gallbladder needs to be removed.
Is that right?
It can get to that point. It certainly
can. So in your study, you said you followed 10,000 people, and you lecture and teach or speak to over 3,000 physicians. Exactly what is your role? What are you telling them how to do? Or what are you advising them on?
What we're telling them to do is how to look at a chemistry, whether it's blood, urine, saliva, tissue, and how to take that information and apply it to your particular patient. If a chemistry is within the normal range, but it's on the high end of normal, and your patient is exhibiting the symptoms that are associated with that particular chemistry, then for Lord's sake, treat them. Give them the right advice, put them on some